My today's guest is Ms. Nienke Feenstra, the president of Infarma. Good morning.
Good morning, dzień dobry.
How cooperation between pharmaceutical companies and government affects easy access for all patients to vaccination system? How can we make this cooperation even better?
One of the surprising things from the start of the COVID pandemic is how it brought everyone together, as crises sometimes have the potential to do. We saw in the beginning, through to unprecedented collaboration, that it was possible to bring drugs to patients who needed it. Pharmaceutical industry cooperated as well to bring PPE materials and disinfectant to hospitals. We sometimes changed production lines to make more disinfectant, for example, and we also started doing home deliveries for patients to avoid them having to go to hospital in times of a pandemic. I'm giving these examples to illustrate when there's an open and transparent dialogue behind a common goal, so much more is possible than we might think before. And I think the same is valid in times of vaccination. There's a lot of knowledge and capabilities on all stakeholders involved in this debate. And I would call for everyone to work together, share that capability, share those knowledge to the benefit of all when it comes to education campaigns, providing infrastructural support, making sure that each Pole gets vaccinated as a way out of this current COVID crisis.
What, in your opinion, are the biggest challenges for Polish healthcare system due to COVID-19 pandemic?
Well, we have obviously the crisis itself, which is a huge challenge worldwide. What we also see right now is that the vaccination is indeed a challenge. The numbers of vaccinated people stay lower than we would have liked to see, which makes it more difficult to fully get out of the pandemic. So a big challenge is to get reliable information to each and every one so that everyone can make a good decision on their vaccination or booster status. We now know that being completely vaccinated might not fully protect against an infection with COVID. But we do know it protects against hospitalization, against mortality. And that is so important to make sure that healthcare systems are still able to deal with this pandemic. And that last part is so important in Poland, where unfortunately we see that some gaps in the infrastructure of healthcare have made it difficult to fight with the pandemic because you cannot do everything at once. Therefore, it's so important to get everyone vaccinated, and let's collaborate to make that happen.
Nowadays in Poland we're struggling with a very high death rate caused by COVID-19. Lately we reached number 100,000. What can we do in the future to slow it down?
It is indeed a very, very sad fact that in Poland we have one of the highest excess mortalities as a consequence of COVID. And it's of course due to COVID itself, which the entire world is struggling with, but unfortunately also due to the fact that we're not able to continue care in a normal way for each and every patient at the same time. Partly because patients were afraid to go to the hospital due to the pandemic, but also because doctors were so hard fighting the disease and were not able to do two things at the same time. So when we look forward, it's important that we not only work on vaccination, but also strengthen the healthcare system. I think everyone now realizes that healthcare is not only important for each and individual Pole, but also for society overall. So let's use that momentum and strengthen the healthcare system in a sustainable way to make sure that when it comes from screening to diagnostics, to getting access to a treatment in a coordinated way, each and every Pole can get a treatment according to a medical guideline in a sustainable healthcare system.
Serious consequences of pandemic are, among others, of course, delays in diagnosis and treatment, especially oncology and cardiology patients. This is, of course, caused by prioritize of healthcare system focus on COVID-19 right now. What can we do to help those patients?
Well, can we do? We need to make sure that also, for example, we have enough doctors dedicated in the most efficient way to help these patients. We can therefore, for example, use more e-health solutions to support them in their work, because one of the big challenges in Poland is that we don't have enough doctors. Even if you look at it on a European scale and you look at the number of doctors and the number of nurses available for each Pole, it's the lowest. So it's not a big surprise. It's then impossible for the doctors to do two things at the same time. Everyone only has 24 hours a day. So we need to make sure that the healthcare system and the people working in there can be as efficient as possible and invest for that as well. And like I said, e-health at large is one of the systems that can really help make the healthcare system more efficient.
You mentioned about telemedicine and e-tools. How important are they in your opinion?
In my opinion, very much. When we look at where e-health at large is implemented in other countries, we see more benefits than we might initially expect. In oncology, the field you refer to, for example, there are a lot of solutions that allow patients at home to monitor symptoms. That way, those symptoms might reach the doctor earlier than when the patient would go to hospital. In oncology, almost more than in any other disease, every day counts. So having those symptoms earlier, first of all, improves outcomes for those patients, which is a great benefit. Moreover, it has shown that patients have less stress because they feel they're taken care of even in their own homes, which is also very important. Doing that with an e-health solution also enables that to do that with less contact with nurses, with less contacts with doctor, which given the challenge that we have in Poland is extremely important. You can also build more tools in there to use the outcomes that you have through these e-health solutions and feed them into an outcomes-based payment scheme. Also, the move towards value-based healthcare will be important, making sure that the healthcare system is sustainably set up, as we discussed a minute ago. So a tool like that has the potential to contribute to that as well. So there's so many benefits to real e-health solutions that I do think it can be the proverbial one solution that allows us to address 4 or even 5 things at the same time.
Let's talk for a minute about the money. Polish government announced big changes in healthcare system. 6% of public outlays to 2023 and 7% after another 4 years. How can we use this money?
As said, we need to reinforce some parts in the healthcare system, and there's a lot of talk on that as well with everyone in healthcare to make sure that we have a first-line system that is stronger, that hospitals also can work efficiently, that there's good coordinated care. A lot of programs have been rolled out that don't even cost a lot of money, like pracowali, but that already show tangible benefits for patients. We also need to invest more in diagnostics. The sooner a patient gets diagnosed, the sooner the patient can get the right treatment, which is good for outcomes for that patient, but also reduces the cost of healthcare. So an investment in good diagnostics in the beginning can also make healthcare more efficient on the longer term. In addition, we need to invest as well in new therapeutic innovations as well. They have the potential to cure or to make sure that patients get much better healthcare outcomes and are a very efficient way to strengthen health of Poles. So that also deserves additional investments.
One of the many challenges we faced during pandemic was keep the drugs and innovative therapy flow. I say keep it on a right level. What, in your opinion, are 3 crucial points of ensuring the country's drug policy stable?
It was indeed a big challenge, but also here, actually, when we look back, especially on the first phase of the pandemic, where governments, out of fear of COVID, because they did not know what to do, completely closed borders. But we saw that when it came to medication, they opened them again. And by a good collaboration between governments and pharmaceutical companies, we saw that medications did reach the patients. So that was already a good example of that partnership. Looking forward, I think it's very important to look at the root causes of possible shortages and make sure that within the European Union we can cover this as a whole. Making sure that, for example, we have a type of labeling that allows drugs to be easily used either in one country or another could help for that we have less regulatory burdens to make sure that we can do that. When we really look at the root causes also of drug shortages, what we see in Poland, and not only in Poland, in some other countries, we see that very often it's also linked due to price differences between drugs, making it interesting for some parties to take a drug from one country to another. And I'm not saying this is a plea to increase drug prices, don't get me wrong, but really as an example to show that we need to look at what is the root cause and then find how we need to tackle that. And for that last issue, we already have a solution in place. The government has a list on which they can put certain drugs that might be sold more in other countries to make sure that Poles can get them when they're in need of those. So I think we have a system that works well. I think we can make steps in looking at the root causes of them and address them better. And on a European level, there's a lot of collaboration already in place to make sure that everyone across Europe, so also in Poland, can get the treatment they deserve.
And my last question is, what's the Infarma goals for 2022?
As said, there's a lot of work ahead of us to really deal with the vaccination by making sure that we get a healthcare system that gives each Pole access to treatment according to medical guidelines. And we're very much looking forward to partner and collaborate on that. We have a lot of knowledge in the therapeutic areas in which we're active, and those are a lot, and we're very willing to share them in a constructive manner to help no matter who it is, whether it's a patient association, a healthcare professional, a policymaker or the government, to in dialogue find solutions that would work best for each and every pole.
Ms. Nienke Feenstra, the president of Infarma. Thank you very much.
Bardzo proszę.
Dziękuję.